and it's very easy to sit in this room and look out, and everybody on the webcast right now, and think, okay, I have access to the internet. I may have a PDA. I've got my cell phone. But the average size company we have is 8 employees. As Terry said, they don't have a human resources department. They don't have somebody to go to for a discussion. To get the information to them, and think about who these small businesses are. They are the auto garage that you take your car to. They are the laundromat. They could be the restaurant. I mean, just think of, they're not necessarily thinking, from a high-tech standpoint. And, the previous panel said, geez, we're just going to provide a website for everybody to go to. That's impossible. We will not be able to communicate. I mean, the way we have structured our program is we are very much technically invested, with our websites to the employers, but we distribute our product through brokers, because what we have found is there needs to be a touching point to these small employers. They don't have that HR department. They're looking for somebody to help them because it's something they don't understand, and they want to run their business. They want to run their business and do what they know how to do, but not the insurance side. So if they can get the expert to help them and help each of the employees with the decisions, and on the previous panel we started talking about how complex the healthcare system's gotten and what the decisions that each employee has to make, not just in the primary care, et cetera, because typically the primary care is down in the rung somewhere. It could be more to the OBGYN or specialist or pediatrician or the formularies. There's a lot of decisions to make, and to be able to bring that information to the typical employee is going to be a very complex problem, and it's going to be a big challenge.
One thing that employers will need when they go to the exchange is the ability, even though their employees are picking multiple plans, that the employer is sending one check out to the exchange, because that's different now. Right now, a small employer is buying one coverage from one insurer for all of their employees. And so now they're going to have employees with multiple plans, and they can buy up, and there's going to be all kinds of different costs and deductions for employees. So the employers are used to managing that, the employer share, collecting the employee share, but they need to be able to write one check, whether that's per month, per quarter, annual, however that is, but that one-stop shopping. And that, I think, extends to something that was talked about before. You're going to have employee turnover and employee change of status. Again, if the employees are getting their insurance through the employer, that needs to be managed seamlessly for the employer through the exchange, that it's just taken care of. Because, as it's said, the employer is trying to run a business. They're not in the health insurance business. They're in the garage business, or as I was in the seafood business. And we're worried about what the exchange rate with Japan was, not what is happening with health insurance today.
This is really complicated business, and it's going to be tough to get all of this right from the start. And I think for that reason, it might be smart to try and start small and focus on those employers up to 50 initially, at least. Those are the employers where the need is greatest. I think as you move up the employer size scale, you run into the greater risk selection problems. The larger the employer, the greater that employer's capability to self-fund. And as Terry was suggesting, when employers have that ability to choose between self-funding and essentially paying a cost that reflects just the risk profile of their own employees, as opposed to going into the exchange, you're going to have those employers that have sicker employees deciding to go into the exchange. And so I think it's probably a good idea for the exchanges to kind of figure out how to get things working right just for individuals and the small groups first before it takes on those larger groups.
The exchange has the opportunity to bring a very complex product together into something that is relatively simple. One bill, one place to call, You make those changes to one place, and the exchange is doing all the administration behind the scenes to divide out the premium and send it to the correct carrier, send the eligibility off to each of the carriers, and can make something that's a lot simpler for the small businesses. We talked a little about the expense structure, possibly the exchange or administrative expenses or pooling people together. Those are getting at the small dollar amount of the premium that's paid today. What we really need to also make sure is we're really looking at the cost of care, and the previous panel was talking about from the quality side, but we have to also engage all the small businesses and the employees themselves into wellness programs, so that we are balancing out looking at the administrative side, but the huge opportunities in the cost of care side. And we have to get to the cost of care side, because that's the big dollars. That's going to be 85 cents on the dollar, and that's the side you can reduce. Just pooling people together is not going to reduce costs. If we said we're just going to pool people together and we're going to get a better price, well, the auto companies would have never had a problem with health care. And so we just have to make sure where our focus is.
I mean, even if we get all of the details right with respect to the exchanges, and we get these new competitive marketplaces and make it easier for people to compare and contrast policies, and we get a lot of administrative simplification, it's not going to be a silver bullet for our affordability problem. And the solution to that is primarily going to have to come from the reforms that are about reforming the delivery system, the healthcare delivery system. The need to make sure that the rules and that the products offered in the exchange closely mirror what's offered outside. If you've got products offered outside that are a lot cheaper, as I was indicating, than are offered inside the exchange, those products are likely to be more attractive to healthier enrollees, businesses with healthy enrollees, and you're going to wind up with higher prices inside the exchange than outside of the exchange. Now, some of that can be addressed through risk adjustment, and I think developing effective risk adjustment mechanisms will be critical. There's also, though, this problem I was alluding to with respect to CalChoice, the current exchange, small business exchange operating in California, where you have selection against the wide network plans within the exchange. So you have those employees, that come into the exchange through their employer, and now have the ability to select from the different health plan options, and what we've seen is that the sicker employees tend to opt for those plans that have the widest networks. So you're going to need to kind of solve that problem as well. Risk adjustment will help with that. But these are just things that I think we really need to kind of be cognizant of as we implement exchanges.